Interim final regulations. Interim final is a fancy word to say not really sure it's going to be final, but we think so. Dependent is solely defined by relationship of child to employee. So you can now scratch through all your fancy provisions in your dependent language that either refer to Internal Revenue Code 152, because the legislation doesn't care what the Internal Revenue Code thinks, and anything that says student status, marital status, gets a certain level of financial support, has 1/2 support by their parents. All of that's now gone by these interim final regulations. I only care, are they a child of the primary covered employee? That's a dependent. And are they age 26 or younger? That's it. I don't care if they go to school. I don't care what they do. I don't care if they live in the basement. You cannot rate premiums differently. We're not going to allow you to call a fancy lawyer like me and say, guess what? You can cover the 20 week. As sad as this is, and it really is sad, this is my only political stance, I'll tell you today. I get a lot of clients that don't want to cover domestic partners, even though they're required in certain insurance states. And we find some very creative ways to avoid it. And that's probably the moral bankrupt to my issue of my job at times. But you do what you're supposed to do, and you do what you're asked. And a lot of times we do it by rating them differently. Because effectively somebody's not going to pay that much money for insurance. You can't do that in dependence by the code. So you can't say, listen, I'm not covering the guy in the basement, but if I have to put it in, his monthly premium is $10,000 a month, everybody else is $100. So it's got to be the same. Special enrollment period of 30 days. A lot of the challenges for dependents in this law was when's the plan year and what's called open enrollment, when can I get on the plan? We've created a special enrollment right for individuals, so you can't just not have an enrollment period to let them on the plan. So effective the first day of your plan year for most of you, there will be, like it or not, a 30-day window for that person to receive coverage. Most of you have open enrollment, so this isn't an issue. But one way or another, a dependent gets to be on that plan the first day of your plan year. Unless they have access to another employer's plan. And this was probably the best part of the regulations to try to find this, because we didn't know what access to another plan meant. And that doesn't mean the spouse's plan. So if they're married, they're 25 years old, they're not going to school, because remember, most of our life with dependents thinks of a dependent who's going to school that's age 23 or 24. They could well be doing whatever, but they can't have access to an employer's plan. But if their spouse works and the spouse has a plan, that doesn't count. It's only if they're working and they have access to their employer's plan. Yes? No.
Is that at least the requirement?
Nope.
You keep on talking about living in the basement.
And that's why I talked about the euro. It's a great question. That's why I talked about the euro. A lot of times in the word, we use words that don't, in law, this is probably, my wife always says, don't talk to me like a lawyer. And then I talked to her and she said, you're still doing it. I don't know what we're talking about, and she says, still. And we use words that don't mean what they mean to you. And I think they mean to me. So I read the word dependent and I say, it's somebody who's a child of the person. You read it and say, dependent must mean I'm dependent, in normal English, normal person vernacular, thus reliant on somebody. Not true. You can pick that word as banana for all I care. If you have a banana who's age 26, who is your lineal descendant, they're covered. Insurers may treat this differently and have flexibility, meaning nothing says you cannot put an age 26 employee or dependent now on your plan today. You could have done it yesterday. Nothing says you have to wait until the plan year. Insurers are going to treat this vastly. A lot of insurers came out initially and said, we're going to do this early. It'll be great, we're so great, we want to put everybody in. We're going to allow this today. Some of them said we're going to allow the first plan year. I know Pacific Source had something. You can ask if you want to talk about it, but what that date is not necessarily law. You're certainly welcome to go to your insurer, and they may well say no. Because guess what? As much as insurers get a bad rap for not being flexible, they've got to go to Salem, they've got to apply to a form, you've got to deal with a woman who will literally take your form if she doesn't like you and push it to the bottom of the pile. And it's a real pain to change something. And they've got certain limited windows within their compliance departments where they can fill in different information. So it's not as easy as you think it is. Why can't I just have this provision in here like that? Change the document, I don't have authority, it's a big thing. Yes?
So if the definition is not dependent necessarily, but a child, does that mean that that doesn't include like the grandparent who is taking care of
The age 26 grandparent. Two different issues.
So you employ the grandparent, they have this grandchild living with them, is that their dependent?
Right.
Do we cover that?
The grandchild, no.
Okay.
Again, I don't care what you do outside of this. It's just not required by the law. So So that's an important concept.
I just.
Law says you've got to cover a child, and that's just a lineal descendant of that individual. So the grandchild doesn't count. It doesn't mean you can't cover the grandchild under what we used to think is called a dependent, but it's not required.
So a dependent is different.
Right, a dependent is a child, or my definition was a banana. But that doesn't mean everything else changes. It just means the law says you have to cover dependents regardless of what you think that word means if they're a child to age 26. What you do around that is your own business.
So does that translate over to stepchildren?
Yes.
So
It may be considered a child. Yeah, we're not looking at birth certificates, we're looking at normal parent, child age, adopted children in the same way. Probably even somebody who's living with you in a custodial guardianship way, but that's not the regs. Somebody has a question. Mike, you're not allowed to ask a question.
Okay. I'm just gonna do an FYI, all the insurance companies in Oregon, except for one that I'm aware of, and they're still making a decision, has decided to implement this in their small group plans that's under 50 employees and under, by July 1st. So every small group plan will have this, and some are May 1st, some are June 1st, but by July 1st. Pacific Source is May 1st.
Yeah, that's not true in dental, that's true in health.
Yes, health, medical insurance. Large group can opt out.
Okay, so dependent coverage. Employer has 20 employees, 20 full-time, 8 part-time. All full-time employees are eligible for the health plan for January 1 plan year. 10 individuals are participating. Health plan contains dependent coverage up to age 24. One individual covers dependent is turning 25. Their health insurance normally. What would happen in that if we didn't have an insurance change, if you didn't do anything else, effective January 1, 2011, calendar year plan, you'd have to offer coverage to that 25-year-old dependent, but not prior to January 1st, 2011 if you didn't put it in your plan. What would happen to that individual? They'd probably elect COBRA for that 60-day period. Now, if they were really smart, they'd elect COBRA and not pay for it. And as long as they didn't have any health claims, it wouldn't matter anyway. And they'd actually have 100 days to do that. But rarely are people that smart.